Today we are going to discuss low back pain in reference to all population, and we are talking about non-specific low back pain. So low back pain is a common painful condition affecting the low portion of the lumbar spine. So as highlighted over in the picture on the right, you see it's starting at L1 and L standing for lumbar. This is the lumbar region of the spine. Going down to L5, and it's also referred to as lumbago. What they don't have highlighted is S1, which sometimes it affects S1 as well, so L1 to S1. And it affects about 85% of the population, both general and athletes. And with the 300 million cases per year, it brings in about or over $100 billion to treat. And even with the most modern or the most high-tech, the best of the best diagnostic testing and imaging, it's hard to locate or pinpoint the culprit of low back pain. Like what exactly is causing this pain? Oftentimes it's referral pain, whether it's your hip or your knee, and that's what you're reporting the pain as: knee pain, hip pain. Not realizing that this pain is stemming from your lower back. As far as the progression of low back pain, it ranges from acute, subacute, and chronic. And acute meaning under 7 weeks, so any pain that's referred or recognized, and they seek help immediately, which we pretty much see in workers' comp patient, and it's caused by a traumatic event in that case. And they feel that pain and they report it, and then they're referred to physical therapy or pain management. From that, it's the subacute stage, where it's any episode that's lasting 7 to 12 weeks from the date of the onset, from the first initial recognition of pain. And then anything longer than those 12 weeks, it turns into chronic low back pain. And a lot of times, most of the cases that you'll see in physical therapy are chronic low back pain. Patients come in and they've had this pain for years. And they don't say anything, they don't report it. Or even if they do, a lot of times physicians will say, "Oh, it'll pass. Just here's some exercises you can do, it'll pass." So you just have to keep in mind, like, how long did they have this pain? And most times it is the patient as well. They think the same thing, like it will pass, so they don't say anything and they don't report it until they've been dealing with it for quite some time. And some signs and symptoms of low back pain are just as simple as the pain itself. It'll be sharp, dull, or burning pain. A lot of times it's causing stiffness, and to try to relieve or exonerate yourself from the pain, you tend to stretch. So that's a relieving factor: stretching or flexing your trunk area to relieve yourself of the pain. And some things you consider, like during evaluation when talking to patients who have this pain, or any person who has this pain, you can remember to yourself, well, how long have you been living with this pain? Are you in the acute stage? Are you in subacute? Is it chronic? Was there a traumatic incident that caused this pain? Was something fall? You have patients who come in, as I mentioned with workers' comp, who they work at the airport or they work in hospitals. They're lifting heavy objects or lifting patients, and they either pull a muscle, they feel a pull in their back, or something falls on them. You see it a lot where nurses or people working in hospital settings try to lift patients, and instead of trying to go get help or using other advices to help them lift, they do it on their own, and sometimes that causes an accident. What does your daily activities consist of? So as I mentioned, persons working in an airport or in a hospital setting, those are very strenuous jobs to have. Another thing that we consider, or we ask patients, is what is your goal? What is your motivation? A lot of times it's as simple as just getting rid of the pain. Not simple as it's easy to do, but that's just it. That's what they want, to get back to their life before the pain. Are they ever still repeating therapy due to their pain? What wasn't mentioned before is that although 85% of the population will experience some form of low back pain, a lot of times we don't realize that 90% of them can get better. 90% of that 85 improve. However, 50% of that, they have a recurring event in which they have more back pain, or it's in the same area, and then they're back for physical therapy or pain management. Now we'll discuss the treatment for lumbago or low back pain. Exercise prescription. What we usually do is it entails stretching, cardio, strengthening, and the initial evaluation will go through the McKenzie method, which, to be more specific, is a series of movements. And a lot of people have been and usually get certified in it, even if, So what was found was that when you extend your trunk or you flex your trunk, it relieves pain. The movement in itself helps move the spine, and what was found was, after so many patients, like, oh, when I move this way or when I move that way, I feel relief. The pain subsides momentarily. Of course, some medicinal modalities are local injections, steroid injections, which are corticoid shots. It is an anti-inflammatory, so a lot of times when patients come in and they have excruciating pain stemming from their lower back, they'll get these injections, usually once other treatments have failed. And then we have the TENS unit, which is electrical stimulation, where these electrodes are placed on the person's back, the lower portion of their back, and it sends electrical currents through these electrodes to help subside the pain. Again, it is a temporary fix. Oftentimes with the TENS unit, we'll place heat or ice to help it move through and also soothe the patient. A lot of patients like it. It's pretty much preference, though. It isn't. None of these are law. Every case of low back pain is different. Every person's injury is different. Every person's body is different. So how they manage their pain, how they treat their pain, and how their pain is relieved will vary. Nothing is golden, if you will. There's also behavior therapy and muscle relaxants such as naproxen and anything a lot of people even use over-the-counter meds such as Aleve or Advil to help relieve them of their pain. Behavior therapy, helping them sit properly, sleep properly, and I'm using air quotes around the word properly, because you aren't taught how to sleep. It's something that you just do. But with that behavior therapy, you teach them how to roll over without either injuring their back or injuring other parts of their body, causing muscles to be pulled or overstretched. And then managing low back pain, we hear time and time again how exercise is medicine, and it really is. Movement is medicine. The key is to get people up and to move and help them strengthen their body, strengthen their back muscles, strengthen their core, stretching, which is what physical therapy is is for. What people go who have low back pain, what they go to physical therapy for, whether they know it or not. Their primary care doctor would send them or refer them to physical therapy, and that's what physical therapists would do: strengthen back muscles, strengthen their core, as well as stretch them out, have them stretch actively as well as passively. And passively would be the soft tissue mobilization that was listed before, as well as traction, so pulling the leg away from the spine. Not too much to hurt the patient. Of course, everything is tolerated. If anything goes beyond a certain level of pain, then all mechanisms stop. Postural adaptations, which I talked about before, with behavioral therapy, the epidural injections that I mentioned before are recommended and suggested upon failure of management initiatives. So if all else fails, then epidural injections are recommended. So as far as a case study, one case is a woman who is 44 years of age, and she's been diagnosed with low back pain. She has bilateral hip and pelvis pain. And her case is special because her mother was also diagnosed with osteoarthritis in the lumbar region of her spine and degeneration in her early 30s, just as she has. So her age puts her at risk. Her family history puts her at risk. Due to her pain, she hasn't been able to work. She leads a more sedentary lifestyle. She isn't working. If she's in too much pain, she won't do anything. So activity level also puts her at high risk, in the high risk category for her condition. Some of her goals are just, to be pain free. This, as I mentioned before, that's a lot of people's goal, just to be pain free and to get back to their life before they're injured. However, there are other special considerations: tolerance level, health history, medications. A lot of times patients will come in and for their initial evaluation, they didn't take any medication. And when we asked, they said, yes, we do take pain muscle relaxants. So we encourage them that before they come to therapy, the 30 minutes to 60 minutes, they take their medicine, just so that the pain doesn't become too unbearable that they can't go through with their therapy session for the day. Exercise testing is and includes, but is not limited to, abduction with resistance. How strong are your muscles going against my hand? Same thing with adduction. Both times going against my hand. Hip flexion. How high can you raise your leg up? And this is one of the exercises to the right that shows it should be at a 90-degree angle. Textbooks would prefer it to be at a 90-degree angle, and most times people don't want to raise it higher than 30, unless the other knee is bent. Trunk extension, trunk flexion, those go under the McKenzie method that was talked about earlier. Quad stretch. A lot of people have tight quads or tight hamstrings, which also can cause low back pain. Observing the patient's gait. And some exercises that they go through, the treadmill, and you see these people about 2 to 3 times per week for 1 to 3 months. And they're going through cardio, they're going through stretching, they're going through strengthening exercises as demonstrated in these pictures, with the partial curl, the double knee to chest, single knee to chest. Trunk rotation is a good stretch for low back pain. And in conclusion, as mentioned before, the cause of non-specific low back pain is still unknown. However, a lot of it is discovered through referral pain, and patients won't know until they have it. And lifestyle adaptations help to relieve the pain. Exercise is medicine, and movement is the key to it all. So helping to move and strengthen those muscles helps heel, low back pain.